physician and you've given healthcare, or you're a patient and you've received healthcare, you've talked about the cost of healthcare, whether that's to the overall system or to an individual or a family. If you ask 5 different people why healthcare costs so much in the United States, they'll give you 5 different answers. And this may leave you confused about what's going on in our country or what to even do about it. But I'm here to explain that all of the reasons for the high cost of healthcare, no matter what anyone tells you, can basically be broken down into 4 different categories. So let's get into it. In case you happen to stumble upon this podcast and you actually don't know the breadth of the problem, both in nominal US dollars and adjusted dollars, our national health expenditures, including both private and public, have skyrocketed to actually include nearly 5 trillion US dollars. What does this mean in terms of how much the government or taxpayers spend on this money? So although this data is a few years old, back in 2021, we spent about 23%, and it's actually even closer to a quarter of the US government's federal budget goes to Medicare and other healthcare expenditures. What this means is that 1/4 of your taxpayer dollars go towards this, and that means less money for yourself as well as less money for any other of these other initiatives or policy issues that you care about. So the question of healthcare costs may not seem like it affects everyone, but every United States citizen should care about this issue. In case you've ever wondered how do we do compared to other countries and are we really all that bad? Yes, we are, and we're bad in terms of everything. So we're bad in terms of the costs. We far, far outpace, in a bad way, any comparable country in terms of the total health spending and household out-of-pocket spending, except for maybe Switzerland, in terms of how much we pay for healthcare. And I can tell you that we don't get any better outcomes for this. We have worse life expectancy, we have worse maternal morbidity and mortality, and we have worse mental health outcomes. So why? Number 1 of the 4 reasons includes increasing administration costs. Now there's a couple different ways to look at this, but basically about 25 to 30% of every healthcare dollar we spend, whether that's in the hospital, home healthcare, drugs, or in the clinics, 25 to 30% of that goes to administration costs. Now, about 15% of that administration probably can't be cut down and is pretty necessary to helping the system run, but about 15% of it is in excess. Another way to look at this is how much the percentage of administration costs has gone up since the 1970s, since we started keeping track of some of this data. And we've gone from 17% to 30%, nearly doubling it. Again, we see another version of that 30% number as the total administration cost of all of healthcare. Number 2 in our list, higher prices for drugs. It's not just a media headline. The United States really does outpace everyone else in terms of our cost for drugs. So if we look at this line is 100%, meaning it's the cost for drugs in all of these other countries. And this number is basically the percent of 100% of that, meaning that for all countries across branded drugs and generic drugs, we spend about 278% of what other countries spend, or 2.78 times that amount. For example, we spend 2.7 times as much as the UK. If you want to look at our branded drugs, we spend over 4 times the amount of other countries. And although we spend a lot less on our generics, our overall costs do end up being astronomically higher. Number 3 on this list, and likely the most poorly understood, consolidation across both physician providers as well as healthcare insurance. What this means is that there's really not that many different healthcare insurance players in the market. Almost half of the plans you see, whether or not they hold the Blue Cross Blue Shield name, it is actually Blue Cross Blue Shield. And about another 15% is the United Health Group. If you include Optum, which has multiple holdings across all kinds of healthcare industries, not just health insurance, you will be very scared of United Health Group and what it can do and has done to the healthcare industry. It truly deserves its own series. We see this both across the private insurance market as well as the Medicare market. Now, it's not just a problem on the health insurance side. Due to private equity money, this is the number of private equity deals that have occurred in these specialties. And as you can see, they've bought up a lot of space in dermatology, ophthalmology, and a lot of these specialty acquisitions in these areas are now on the rise as well. What this essentially means is that one firm is buying up a lot of different practices, whether you realize it or not, and heavily increasing the prices, as these private equity firms quite literally are only meant to return in investment or profit on an investment. So they don't make any decisions that don't result in an increased profit. Now, there's also other systems like health systems, large nonprofits that on paper are nonprofit but truly just act like for-profit entities. They have also been buying up hospitals and physician groups. There's a large percentage of health systems that have over 30 hospitals underneath them. Overall, what this means is that there's monopolies forming on both sides, on the health insurance side and the physician side. And whenever you have this level of monopolization and financial consolidation, it leads to less negotiating power, essentially, for the consumer, which drives up prices. And this you don't really see captured in any one category. It kind of just overall inflates our prices and worsens the healthcare experience for everyone involved. Fourth, we do pay more money for our doctors and nurses' labor as well as procedures. We do so both across specialists as well as general practitioners. In terms of the specialists, even accounting for how much of our overall budget and GDP is spent on healthcare per capita, we still spend astronomically more on specialist care. And ironically, although we actually morally devalue primary care physicians, we still pay them better than other countries do, although we don't pay them nearly as much as specialists, despite the value they have shown to decreasing overall costs to the system. Overall, if we want to sum it up, I'd say what we have talked about explains about 50 to 70% of our excess funding, if not more. Like I said, the effect of healthcare consolidation and monopolization can't really be quantified directly, but what I can quantify is that we have about 15% more in administrative activities. We spend about 10 to 15% more for drugs. Our physicians earn about 10% more. And when you also add in the cost of monopolization and consolidation, that really gets you above 60%. And now when the next time someone asks you, why does my healthcare bill drain my bank account every year, you can give them a very intelligent explanation as to why, and perhaps it'll inspire you to advocate for these issues and decrease our healthcare costs. Thank you, and until next time.